It's a bacterium, not a virus like COVID and flu is. So it responds to antibiotics. It's a bacterium that you ingest, not something that flies through the air, but you eat contaminated food. Um, it's not killed by cold temperatures, so it can live in your fridge. It can survive on surfaces in the kitchen for a prolonged time. This is part of the warning for the public. If you have identified one of these products that could be contaminated, you may want to clean surfaces around where that meat may have touched. Incubation period can be short as a day, but can be as long as 10 days. It starts with a mild gastrointestinal illness, but for people who are at higher risk, which is mostly pregnant, extremes of ages, mostly the very advanced age group, or have a weakened immune system, may not be able to contain this after this mild gastrointestinal illness, and then it spreads through the body. If it reaches the bloodstream, typically you see flu-like illnesses, fever, muscle ache, and fatigue. You can then, from the bloodstream, there's two organ systems that are really attractive for listeria. One of them is that it causes a meningitis, so the brain, which is typically a life-threatening illness. The other affinity that it has is to the placenta. So women who are pregnant are at very high risk. They also get generally a flu-like illness, can have a meningitis, but they're at significantly higher risk of losing the pregnancy or premature birth. This can also happen in animals, and therefore pregnant animals can then carry that on to workers in that field. It is a potentially serious illness or deadly illness in very young newborns as well. So those extremes of ages, pregnancy and immunocompromised people are at highest risk. Maybe stop there and
yeah, thank you, Dr. Albrecht. So we have one question about how often do we see listeriosis, listeria clinically?
So we've had over the years, we had several outbreaks. This one is large, not really large from the patient numbers, but the involved product, which is a very large company. It's Boar's Head, obviously, and it's a plant. It's a very large plant of theirs in Virginia, which has sort of distributed potentially infected or affected meats to a very widespread area, mostly in the eastern United States. We now have cases in at least 14 states. Haven't updated this in a while. South Carolina was not on the last one. Now we have cases, and they may have actually potentially involved in the death of these patients, which is not totally unusual for patients who get very severe disease. But other than these outbreaks, we see this occasionally in farm workers. We see this occasionally in very localized outbreaks. We consider this if patients present with meningitis and are at high risk. In my personal experience, and we see all of the infectious disease cases for a widespread area here, probably one per year, one every 2 years. So it's not a very common illness. It can occur without outbreaks, so we're always on the lookout for this, especially in the high-risk populations, but it's not a terribly common occurrence outside of these outbreaks.
That's good to know. And just to repeat for our listeners, the product that's involved in this is boar's heads meat, which are carried by, I think, many of our local grocery store chains throughout the state of South Carolina, which is why the Department of Public Health issued an alert on this. I think, Dr. Albrecht, you mentioned that there are antibiotics that are used to treat this. Can you tell us a little bit about how treatable it is, and again, how you tackle it?
So first of all, there's no vaccine, and again, several standard antibiotics, essentially regular penicillin treats this in a vast majority of cases, and related antibiotics, and this is not difficult to treat or kill. The problem is thinking about it, diagnosing it. But we have, for instance, panels for meningitis, and it is on these. It's not something that would take us by surprise. Coverage of patients admitted to the hospital with these kind of conditions, we would think about this, and we would not have problems diagnosing this, and we would not have problems treating this. Problem is, once an infection reaches your brain, it is a serious illness and can leave sequelae, even if you treat it successfully.
So once you start to believe you're having some of these serious symptoms that are being described, it's important to seek treatment very quickly.
Yeah, I mean, don't go to the emergency room for flu-like illness, especially if you have not been exposed to any of these products. But deal with it, be alert, be aware that this outbreak is happening. Again, there's probably millions of people who ate Horsehead products, and we have between 40 and 50 serious infections out of it. Not to minimize this, because it can be a deadly illness, but not everybody with a mild flu-like illness or cold needs to be afraid that listeria is going to overwhelm their body.
So I guess our best advice right now from the Department of Public Health is to check your refrigerator for this product. And if you're finding yourself with these symptoms and becoming sicker, it isn't automatically a reason to visit the emergency room, but don't let it go too far, too long.
No, and it's 70 products. It's a significantly wide cast net that they have there. Again, that hasn't been found in most of these products. They're just worried because products from this one site, a lot of products that you see in your local deli are from other sites, and really it's very limited what they've in products that they found it, but they've, just as a measure of caution, which is probably appropriate given how severe this can be, have recalled all products from that plant, and that's now 70 products. So it's a little more taxing to look through this. I went to Publix yesterday and bought some boar's head salami, so I needed, but it's neither from that plant nor it's the right salami, so I'm okay. But everybody needs to look at what they have, and if you have a half-eaten deli sandwich that you don't know what the package is, probably don't use it, and clean around what that has touched and discard it.
Our media partners, I believe, have a link to the Department of Public Health details on this, so you can look very specifically at what products are involved on that press release from the Department of Public Health. And I'll ask now if any of our media partners have any further questions about this they'd like us to ask Dr. Albrecht. You can post them in the chat right now. I think, Dr. Albrecht, you mentioned the highest risk folks for this potentially are the very young and expectant mothers. Who else might be a particular higher risk?
So it's the newborn. It's not 2 years old. It's 2 weeks old. It's the extremes of ages. The older, the higher the risk. Immunocompromised, and what's very specific for listeria is pregnant women. Not so much a risk to the mother, as in we've talked about COVID and influenza and stuff, but this is a very severe threat to the newborn to lose the pregnancy or to have premature birth because of affinity to the placenta.
And older folks as well, you said, right?
Yes.
With other comorbidities.
And immunocompromised. Heart disease, lung disease does a lot for COVID, doesn't do much for this, but being 85 years old and have a weakened immune system by age sets you up that you cannot control this, and then it spreads through the body.
Once the infection reaches the brain, is some of the damage already done?
Some of the damage is done and the brain doesn't regenerate very well, but initially it's a meningitis. So it's the skin around the brain. The brain damage is limited to later stages. So if you find it as a stage of meningitis and the patient especially if the patient has an immune system, they usually get over this without significant sequelae. If you have somebody comatose in the intensive care unit, even with correct treatment, you would expect a prolonged course and not full recovery. But most people we treat successfully. It's about thinking about it, doing the right tests, and getting therapy on board as quickly as possible. But again, most of our treatment will cover this.
Got it. Well, thank you so much. We appreciate your time, Dr. Albrecht. Thank you all for joining us.